All right, good morning. What a wonderful morning it is, and thank you all for coming out today. Today we're here to celebrate the anniversary of Gaston County's tobacco rule, which took effect 2 years ago. 2 years ago today, and we celebrate the fact that this rule bans the use of all tobacco and vaping products on all county and municipal property, including buildings, grounds, vehicles, parks, greenways, and indoor public places where the public gathers. With its passing 2 years ago, Gaston County now has the most comprehensive tobacco policy in North Carolina. As such, this rule has accomplished three very important things. First, the rule protects others from the exposure of secondhand smoke and aerosol by carving out safe places for the community to gather and breathe easy in Gaston County. Second, the rule provides healthy role modeling for our youth by providing, again, safe spaces for our children to surround themselves with where adults are not using vaping products and tobacco products. And finally, this rule helps those who are thinking of quitting to be successful by having, again, more places to go and frequent that are free from tobacco and vaping usage. But most importantly, today we celebrate that these past 2 years have been a significant step forward for Gaston County and its citizens to live longer and healthier lives with less exposure to tobacco and vaping products in our community. Lastly, I'd like to recognize some important groups of individuals who have made this happen. First, our Department of Health and Human Services Board of Directors, and you'll soon hear from Robert Browne, who will speak with you. Also, the Board of County Commissioners, who also passed the rule unanimously. And also our partners at Tobacco Free Gaston Coalition, but probably most importantly, the many, many citizens within Gaston County who have supported this rule and stood behind it. The pandemic prevented us from gathering and giving the tobacco rule its proper recognition 1 year ago on its anniversary, but today we are happy to be here to announce 2 successful years. And with that, I'll now turn it over to John Lowry, Cancer Services Board Member, for his personal impact story.
Thank you. Good morning. It's great to be here today, and if you'd been in my shoes, you'd know exactly what I mean. First of all, I want to thank you for the opportunity to share my story of my battle with stage 3 lung cancer on 3 different occasions over the last 5 years. Surviving to the point today of finally being declared cancer-free 1 month ago. My battle with lung cancer began in July 2017, and I was diagnosed with cancer in my left lung, upper lung, my left bronchial tree, and my lymph nodes on the left side. I was told I had 12 to 18 months probably to live. And my options were palliative care and just a couple other options. I said, no, that's not an option. Let's go for it. I want to go for it. So they treated me very, very aggressively. So I began chemo and radiation at the same time for 6 months. And then in January of 2018, my PET scan showed no cancer. That was a great day. And then I had checkups every 6 months, and it then showed in 2018, January 2018, that I had lung cancer back in my lower left lung, and at that time the only option was to completely remove the left lung, left bronchial tree, and all the lymph nodes. Thankfully, after successful surgery in October 2018, the CT scan and pathology report showed the cancer was gone. Then 2 years later, in October 2020, cancer was once again found in my right lung. I'm going, I'm running out of spots. But they could only aggressively treat that with radiation. After 2 CT scans, I learned in November of 2021 that my PET scan showed no signs of cancer in my right lung, and on another follow-up in June of 2022, 1 month ago. Another CT scan and testing showed no signs of lung cancer, and I was declared cancer-free. The purpose of this morning's gathering is to recognize the needs of our community as it relates to devastating situations created by tobacco and various tobacco products that can lead to cancer. In addition, I wish to recognize our county commissioners and our health department for having unanimously passed a new rule 2 years ago that effectively is effective today to make all indoor local government buildings, grounds, parks, vehicles, and indoor public spaces smoke and tobacco free. This is a giant step forward to improve the overall health of all Gaston County residents and visitors. I'm here to tell you, cancer impacts people of all races, all religions, economic status. It doesn't matter. It does not discriminate. And to be honest, if I may say so, cancer sucks. Let me better illustrate this point. I think all of you here have probably known somebody or had a family member or a friend that has had cancer, and you know the impact and the devastation it causes. Cancer impacts almost every one of us in one form or fashion. I am especially grateful to God, my family, and Caramount Health and my friends. I can personally attest how fortunate we are in Gaston County to enjoy a first-class hospital in our community that remains locally owned and operated and provides an outstanding professional staff and team of doctors and nurses who are second to no one. Caramount Health has had a significant impact on the quality of my health and my continuing recovery from cancer. In my mind, they're the best in the business. I must also recognize our outstanding staff at Cancer Services of Gaston County, led by our Executive Director, Kim Elmore, Susan Carson, and Patricia Adams. And we simply couldn't do it without all of our volunteers. Our volunteers are priceless. On average, Cancer Services of Gaston County will serve between 700 and 800 local citizens impacted by cancer every year. The sad news is these numbers grow every year. However, Cancer Services has never once missed providing the service they need or the assistance that we provide, even despite several setbacks in recent years, with our biggest issue being able to raise sufficient funding due to the impact of the COVID impact the last several years. That eliminated pretty much our fundraising events, but yet we have survived and we have continued to serve, and we've not missed a single patient and don't intend to. Cancer Services provides liquid nutrition, medication assistance, medical equipment, transportation assistance, wigs, mastectomy bras, prosthetics, and other essential needs. All needs are evaluated on a case-by-case basis, and all of our services are free of charge. Our team also provides tobacco awareness programs in our area schools to educate young people about the dangers of smoking and its cancer-causing tendencies. We bring the community together and raise awareness through annual events and partnerships with other community organizations to help provide support for all cancer patients in Gaston County. Speaking of friends and family, I would be remiss not to recognize the outstanding support that I have enjoyed from my family and friends who have been a real blessing to me and motivated me to never, never, never give up. My friends and my family will never know the role they played in my recovery and my desire to beat cancer. The cards, the texts, the emails, the visits all provide support, faith, and desire to keep moving forward. Good friends and family are like stars. You don't always see them, but they're always there. Over the past 30 years, I have supported Cancer Services of Gaston County as a sponsor for their annual golf tournament that recognizes the top amateur golfer with a 3-day tournament played at Crowder's Creek Golf Club, Kramer Mountain, and Gaston Country Club. And coming up mid-October, y'all, we're going to have the amateur tournament again. During my treatments, I became more aware of the work being done locally by Cancer Services of Gaston County. I joined the many dedicated volunteers who help make life better for our local citizens with cancer, who feel as though the world has caved in on them, and trust me, they do. The mission of Cancer Services of Gaston County is to serve the community by actively promoting healthy lifestyles and to provide support and services needed by individuals and family living with cancer. So, on behalf of Cancer Services of Gaston County, I am deeply touched and honored to address the importance of this new county law that will improve the overall health of our citizens for decades. Thank you.
As been mentioned before, good morning, and it's good to come out before you today. I'm Robert Browne, and I'm chair of the DHHS board. And as we met several years ago to discuss the tobacco-free policy, we wondered, we were fearful we'd get a lot of pushback. But I'd like to say at this point, we've had no pushback. It's been greatly accepted. It's been a successful program. But I want to thank you for coming out today to celebrate the 2-year anniversary of the implementation of the no tobacco policy in Gaston County. As been mentioned before, the policy prohibits the use of tobacco products in county or municipal buildings, on grounds, parks, and indoor public places. The DHHS board extends our gratitude to the Gaston County Commissioners for their support of the policy and their leadership in making Gaston County a healthier place to live, better place to work, and a better place to play. This policy has put Gaston County on the map as having the most comprehensive no tobacco policy use in our state. A couple of benefits of the no tobacco policy are simple yet effective. The policy helps to protect citizens from secondhand smoke and aerosol. This policy encourages healthy role modeling for our youth and creates new norms about tobacco use. Tobacco-free policies help support people to successfully quit using tobacco products. According to the Centers for Disease Control and Prevention, a few of the dangers of secondhand smoke and aerosol from tobacco use are leading preventable causes of illness and premature death in North Carolina and the nation. Secondhand smoke contains more than 7,000 chemicals, of which hundreds are toxic, and with about 70 that may cause cancer. According to the United States Surgeon General, there is no safe level of exposure to secondhand smoke. Secondhand smoke has been proven to cause cancer, heart disease, and asthma attacks in both smokers and non-smokers. A few of the dangers of secondhand aerosol from e-cigarettes coming from electronic cigarettes, vaping devices, and most hookahs, which contain cartridges filled with liquid nicotine. Nicotine is derived from tobacco, and the state of North Carolina considers e-cigarettes as a tobacco product. The U.S. Surgeon General issued a report stating that emitted e-cigarette aerosol is not just water vapor as the manufacturers advertise, but contains nicotine and additional toxins. The best way to enhance enforcement is by informing the public of the policy and by providing adequate signage, public education, and communication on all county-owned property and throughout our county. Over time, it will become the norm for people to not smoke or use tobacco products in these public locations. To our knowledge, there have been no citations issued as a result of the implementation of the no tobacco use policy since it went into effect 2 years ago. And this was our biggest concern, was out at parks, public parks. I mean, it's just natural. You see guys and some maybe ladies, they putting tobacco in their mouth and using it, but we have had complete acceptance of the no tobacco policy, and we're very happy and glad of that. So again, I would like to thank you for coming out this morning and celebrating our 2-year anniversary of the no tobacco use policy, and for your continued support. Amy?
Good morning, everybody. My name is Amy Okonkwo, and I am an upcoming junior. In my past sophomore year, I served on Gaston County's Teen Action Council. And one thing that this group really exemplified for me personally was the importance of education and community youth conversations that can really make a change in our community. And that is so important when it comes to this tobacco rule. I think that one thing that this rule does for our community is that it shows that the education and information that we're putting into our community isn't just words. It's specific and it's important. And it tells our youth that it's important enough to have legislative action be taken in regard to it. And I think that with there being increasing amounts of tobacco use among teens, this legislation is so important because it tells our community and our teens that you don't have to use tobacco products to fit in. And I think that it's such an inherent human thing to want to fit in, and whether it's you buying the newest shoes or the newest shirt or using tobacco or alcohol, other harmful substances, I think that by seeing this rule throughout Gaston County, it truly does show how important it is to take care of your health and avoid using these because of peer pressure. And statistically speaking, we know that those who smoke today, the majority of them began as teens, and this is only increasing due to various policies and strategies used by tobacco selling companies that target youth because of how impressionable they are. And I want to stand here today and tell all of my peers and all of my colleagues, everybody, that tobacco products are not the way to go, and reducing exposure is the first step to reducing the rates of tobacco use throughout our county, our country, and our world ultimately, because it can have such a detrimental effect. And I think that the Gaston County tobacco rule is just the first step at making that change. So I'm going to keep it short and just say thank you to all those who have worked to create this rule. And I think it's really having such an important change. It's starting conversations, and most importantly, it's starting personal conversations with oneself about what they should and should not be putting into their body. So thank you so much to everybody, and have a good day.
Good morning. I am the very proud mayor of Bessemer City. And as mayor, I get to accept all the accolades that have come our way because of endorsing this. But I must acknowledge that all the legwork, everything that was done by Hadia Hayes. And she has done a fantastic job and presented it to the council in a very good way to where everybody agreed 100%. But the city of Bessemer City is committed to providing a safe and healthy environment for our citizens, youth, and the visiting public. In 2016, City Council and I recognized that tobacco use and secondhand smoke exposure were the leading preventable causes of illness and premature death in North Carolina and the nation. There is no safe level of secondhand smoke exposure. To protect the public health and welfare, the City Council and I decided that it was in the best interest of our citizens of Bessemer City to prohibit smoking and the use of tobacco products in all municipal buildings, vehicles, grounds, and parks. The ordinance prohibiting such uses was adopted unanimously on Monday, August the 8th, 2016. We were the first in the state to pass a comprehensive policy. After this amazing accomplishment, we wanted to do more, so we began helping our sister cities in Gaston County. Thus, we created tools like our Breathe Easy cards and Tobacco Support Center online to help our citizens. We partnered with the Gaston County Health and Human Services Department to spearhead the Tobacco-Free Gaston Coalition. This partnership allowed us to share our resources with the City of Cherryville, Cramerton, and others to provide a unified approach to tobacco-free policies in Gaston County. We led the call to action in our community by hosting the Kick Butts Day event in 2017 and the 2018 March the 4th press conference at our Allen Ferris Community Center. At the time of adoption, our original ordinance didn't include indoor public places. However, to strengthen our policy, we decided to amend our ordinance to include public places. An indoor public place is an enclosed area in which the public is permitted or invited to enter. On June the 1st, 2018, City Council and I amended our policy to include indoor public places, thus making us the most comprehensive policy in the state once again. I would be remiss if I stated that the journey was easy. We received a little pushback early in implementation. However, we knew that the responsibility to improve the health of our community for our youth was far greater. Thus, with listening, communications, patience, and good timing, we produced a stellar policy. Our city staff has led with the mantra that we are to be hard on the problem, but soft on the people. We have kept this in the forefront of our minds as we've strived to promote a healthy quality of life in the office and around town. Thank you.
Thank you, Mayor Smith, and thank you to everyone that's been up here to speak today. I want to thank Steve Eaton, I want to thank Amy, John Lowry, and then Robert Browne from the DHHS board. This has been a great event and shows how much can be accomplished when we have the municipalities and the county and the DHHS board working together. This is a major accomplishment, and I want to congratulate everybody here that played a part in that. Thank you all for coming, and have a good morning. Thank you.